Hi, I'm Sheila from Toronto, Canada, and I would like to share with you some tips on how to position yourself after you have had a retina detachment. I've had two retina detachments, and I have 20/20 vision now, and I think what I did really helped out with my recovery and my vision. So I can help you out, hopefully, with some things I have to tell you and share with you. Let me just give you a background. I've had two retina detachments, one on my left eye, December 2010, and one in my right eye, May 2014. It is now March 2015, and I have 20/20 vision now, so my story is a good one considering what could have happened. I have a condition called lattice degeneration, so I'm a little more prone to retinal detachments, unfortunately. But anyways, the first detachment happened on my left eye, which required a gas bubble to be inserted in my eye to push the retina to the back of my eye. So it's, say for example, this is your eyeball, right? This is just a dollar store thing, and this is a little piece of toilet paper. This is your retina, and this is the back of your eye, and this is what happens when your retina comes off. It pretty much detaches like this. And what the surgeons do are they would insert a gas bubble with a needle, and the gas bubble would be inside of your eye, and it would push the retina to the back of your eye. So that's why a lot of people, when they have a retina detachment, they have to put their head down or to the side, so it would, it would push by gravity to the back of your eye. My retinal surgeon in Toronto had let me know to position my head forward and down to the side for a week until the gas bubble absorbed into my body and disappeared. Then he performed laser surgery to weld the retina to the back of the eye where it belongs. He had marked on my forehead an arrow pointing to where my head should be positioned for 1 week, 24/7. So it was pretty much like to the side, and my head slightly down. This was to ensure a secure attachment. The other retina detachment happened May 2014 on my right eye. I had a vitrectomy that involved a more invasive surgery where the vitreous fluid was removed from the eye and replaced with a solution that mimics vitreous fluid. Then a laser was performed during the surgery to tack on the retina. After the surgery, it is 2 weeks with my head positioned face down. So for this one, I had to pretty much get this is a massage table, and I got that from Canadian Tire for $200. And you pretty much have to lay down flat with your head down like this for 2 weeks straight. Obviously, getting up and to go to the bathroom, everything has to be with your face down constantly. And when you want to, say for example, just lay in your bed for a while, you can prop up like 2 pillows like this, and then you have your face down, and you have like a little teddy bear or whatever, so you can have your forehead resting down on it like this. And I find, like, with my arms back like this, it's comfortable, but sometimes like this or whatever. And also when I was on this table, I found that a little pillow on my forehead was really helpful, because it was really a lot of pressure on my forehead. So I would just put a little pillow like this, and have a little armrest here if you have one, or if not, just like this, right? And sometimes I would have my head down like, like this, on either side, just as long as your head is facing down, if that's what the positioning is. And overnight, what I would do is I would set my alarm every 3 hours, because you don't want to be rolling around. on your back, because that could create a cataract. Because the pressure of this gas bubble on your lens is not good. So you definitely don't want to have any movement if you can possibly handle that. But this is what I did to not move: is put a backpack, stuff the backpack with Kleenexes, and then just put it on like that. And then, so you don't roll, you would pretty much lay down like this and stuff a bunch of pillows on this side. And then you could put your head over the edge like this, a little bit like this, to sleep, which is totally uncomfortable, but whatever, you have to do what you gotta do. Just to get a little relief from this flat thing. And you just try to relax like this and sleep, and then set your alarm for 3 hours. So see how difficult it is to roll on your back when you have this thing on your back, and it's really light, so it's Kleenexes, empty Kleenex boxes. That I found to be a good solution, because I was really worried about rolling on my back. And this little pillow was really helpful too for my forehead. So the other retina detachment, so that was the vitrectomy. So on my right eye I had a vitrectomy. That involved a more invasive surgery where the vitreous fluid was removed from my eye and replaced with a solution that mimics vitreous fluid. Then a laser was performed to tack on the retina. After surgery, it was 2 weeks with my head positioned face down, and there was no pain during surgery. It took approximately 1 hour for the surgery for the vitrectomy. I didn't see anything during the surgery as they covered up my other eye, and this eye was being operated on, so you can't see anything, and you can't feel anything either. After it's just like, you know, they put I guess a nerve block on, so you obviously can't feel anything. And after the surgery, it felt like I had a bad bruise, and my eye was swollen and really drippy because I couldn't close it. So that was really uncomfortable and terrible. I eventually will have cataract surgery on this side within the next 5 years because of the vitrectomy surgery performed on my right eye. Usually that's what occurs because the vitreous fluid is removed, so the lens is not getting any nutrients, so it has to be replaced. So that's going to happen, which isn't so bad. They just have to watch, you know, the retina, I guess. Obviously, I have to watch for it if there was any symptoms of detachment. I believe the positioning of the head is most important for proper healing once the gas bubble has been inserted into the eye. I have compiled a list of tips to help you succeed in positioning your body to have 100% fully attached retina. Once again, this is after you've seen a retinal surgeon and have had a gas bubble inserted into your eye. Just quick note of what are the signs of a retina detachment. It includes seeing little black dots. That's what I saw. I saw little tiny black dots and they didn't go away. Or flashes of light. I saw little arcs of light. You just see it and then it would go away. Or a bunch of new floaters in your eyes. If you suspect something is wrong or you see something like that, go immediately to an optometrist to have them dilate your pupils so they can look to the back of your eye to see if you're having any retina issues. If the retina is coming off, it eventually dies within 24 to 48 hours because the retina is not being nourished and sometimes cannot be reattached. So blindness can occur. And also the macula, that's the focus, the very important, most important thing of the retina. That if that is still attached, then you're pretty much safe as far as focus. Hopefully, if you've had any detachments, that macula is still on, which is a good thing. So this is why the time is the utmost essence that you must go to the hospital or someone, or an optometrist or ophthalmologist to take a look inside your eye. When I had my left eye retina detached, it was a side position for 1 week. So I would recommend, you know, a bunch of these big pillows to prop you up. I pretty much was like this the whole week, and even eating like this. I was, you know, eating like this. Everything was like, you know, my face down, and I would have to always consistently make sure that my head was like at that position. It really made a big strain, but it was only 1 week, and it worked out. So that's the most important thing, is positioning. Let's see. I listened to my surgeon, followed the exact directions, and it was well worth the struggle. When I had my right eye, it was face down. So buy a massage table if you have your face down. This is Canadian Tire, $200. Use a little pillow for your forehead. A backpack to wear at night, just so you don't roll. Purchase artificial tears. These, you know, just from the drugstore, $10 or whatever, just so you can flush out, you know, any gunk or anything like that. You do not want to touch your eye ever when this is happening, because you don't want any bacteria or anything. You don't touch or rub your eyes. You wipe from your cheek. You administer the drops, and then you wipe, you know, gently with Kleenex from your cheek. You do not wipe up anything, nothing to your eyes. I wash my hands like about 5 times a day minimum, just to keep your hands clean if you're anywhere near your face. Drink lots of water to keep everything going. Keep positive thoughts. Picture your retina healing 100%. And the doctor's saying your retina has healed 100%. You know, just picture your retina being attached. That's what I did. I just pictured my my eye and how I could see. And set your alarm clock every 3 hours when you go to bed at night, just so you're positioning properly. You know, it's not forever. Just, it's going to be hell, but you can get through this for sure. Have the radio on to pass time. Call your friends on the phone to pass time. Have a little table next to you to avoid getting up. Kleenex, water, eye drops. Keep reading to a minimum, because you don't want to put any strain on your eyes. Bring a list of questions to your doctor to answer when you have your next visit. Eat green, spinach, oranges, healthy food. Have a bath, not a shower, because you don't want the shower, the water dripping into your eyes and then rubbing. Just have a bath and not worry about anything about your face. Use straws to drink to avoid moving your head back. It will be a horrible experience. I went through it twice. One was 1 week for the left eye, one was 2 weeks for the right eye. And it was depressing and worrying, and yeah, it was horrible. But it's a short period of your life, and then you know, the outcome can be so great when it works. I've had, you know, the 2 retina detachments, and it's March 2015, and I've had no reoccurrence. Knock on wood. Knock on woods. And I pretty much almost cried my eyes out, which probably wasn't the best thing, but it was flushing my eyes. Because I was so afraid of it not working. I was so afraid of being blind. I was so afraid of everything, and I just thought I have to just do the best I can to fix it. I have to remember that we live in a time where we are fortunate that laser technology and excellent surgeons can now fix these issues with great success, and I'm very fortunate that in Toronto Western they had excellent surgeons to help me and fix the 2 retina issues I've had. I hope anybody out there is hopefully feeling that this is a positive and helpful video, and I wish anybody's going through this the best of luck. Thanks for watching.